Okay, well, today we're very fortunate to have Dr. Karen Chan with us. She's going to talk about best practices for brain health, and then we'll go over a few resources we'd like to share. And then just a reminder that in the new year, January 28th, there'll be another partners meeting to kick off that year. And that one will have Ann Miller, who has done the social return on investment, SRI analysis of our first grant, but also will be sharing some more information. So, and we'll send out invites for that as well. Okay, well, I'll stop sharing and I'll pass it over to you, Karen.
Thanks, Blair. I'm just gonna start sharing this and hopefully it'll work out well. Does that look okay?
It's coming. Yeah, there it is. Good.
Perfect. Thank you. Just feel free to shout out if there's any issues that come in the middle of the presentation. Of course, feel free to interrupt me. I can't really see usually the chat box quite well when I'm doing this, but yeah, feel free to shout out. Thanks everyone for coming and thanks for inviting me to give this talk today. And I see a lot of familiar faces out there, but also some new ones, and I'm very happy to meet you all. And I'm hopefully someday meet you all in person. That would be really nice. So I wanted to chat a little bit today about best practices for brain health at our partners meeting today. Ooh, let me see if I can get this moving along. And so hopefully what I'm going to cover today is what are the normal brain changes as we age, what the latest research shows in dementia prevention in general, as well as what you can do to protect your brain in general as you age. I like to bring up statistics a little bit, but I think, especially in healthcare, I find we have this really bad bias that everybody gets dementia and everybody has these horrible, diseases and everything by the end of their life. But it's really not true. I think, the stats actually say that only 7% of people over the age of 65 actually have dementia, and about 25%, which is a higher number, over the age of 85. But, I always think about, well, that's 75% that don't have dementia. That's a lot of people. And I think we tend to focus, particularly in healthcare, a little bit too much on the people who have problems, rather than the fact that most people won't have these problems as they get older. And that's a big reminder. This is actually a picture of my grandma with my nephew. One of my favorite pictures. My grandma lived to 97 without having any cognitive issues. She'll tell you like it is. And I think we're very lucky that way. And I like to think about that most people will enjoy their loved ones without any cognitive impairments, usually by the end of their life. But there are, of course, normal changes of the brain over time. The actual volume of your brain shrinks by 5% every decade, once you hit 40. I'm there already, so my brain is starting to shrink. It's all good. But that shrinkage doesn't represent necessarily a lot of cognitive changes with that. It's just kind of this observation. When people get their brain scanned, it always says like age-related atrophy. So it's something we expect. Interestingly, like in terms of the way the brain functions, on functional MRIs, you can see that actually elderly people use both sides of their brain. That's different because when people who are younger are scanned, they tend to be very left-sided functioning. And as we age, we kind of start using the other side of the brain. And that's a very interesting thing. And they think that it's because some of the same pathways that were accessed when you were younger don't work anymore. So then they start having to cross the bridge to the other side of the brain and start using those functions. And that's also maybe why they think things processing speed maybe is a little bit slower because the brain actually has to skip over to the other side and perhaps it takes a little bit longer. There is in general a decrease in neurotransmitters, which are the messengers of the brain. The dopamine and serotonin are not as prevalent, so things move a little bit slower. So these are all normal changes. But what does that really mean for us day to day? It means kind of slower reaction times, maybe a little bit less attention attention than we used to have when we were younger. I know I had a patient who told me he was like a university professor, and he said, like, listen, I used to be able to read like 60 medical papers a day, and now I feel like I get tired after 30. And I'm like, that's normal aging. I think you're okay. Um, and he just has, you can get slower processing speed, as I mentioned, because of some of those other factors, as well as your episodic memory starts to decline after middle age. You might not remember everything as clearly as you used to when you were younger. Well, it depends on the person. Some people never had really a great memory. I always say my mom, unfortunately, has always had a terrible memory, and it's not changed, in the whole time that I've known her for my entire life of 40 some years. It's, probably about the same. So just a little survey here. How many people have maybe driven to the mall, to the grocery store, and you had to really think very hard about where you parked your car? Probably pretty common. Have you misplaced your purse recently? All of those things can be very normal, even without aging. And I think it's good to keep in mind that many things related to the memory, and the challenges with it can be very, very normal as we age. And I think sometimes we tend to attribute it to aging and we think maybe something's abnormal, but it actually is quite normal. Oopsie. So, as I mentioned, episodic.
Oh, you just went on mute there, Karen.
Oh, sorry. How did I get muted? That's very strange. I apologize.
No worries.
I don't know when I got muted. That's very
I think it
strange.
was kind of just when the this slide had started.
Oh, okay. That's very odd. Okay. But anyway, like so you know, with normal aging, you could forget a conversation from a year ago. That's not unusual. You might forget things occasionally, which I mentioned, like where did you park your car? And you might have trouble finding words, and that has to do with more your processing speed. To the information is still there, but it takes a little bit longer to grab it. Or you might not be able to remember a acquaintance's name. For example, I walked down the street with my best friend and we ran into an acquaintance of mine, and I remember the acquaintance's name, but I had to tell my best friend to introduce herself because in the moment I couldn't pull up her name. She thought it was pretty funny, but eventually ended up introducing herself. It's all normal. Those little slip ups are fine, and don't necessarily mean there's anything wrong with you. So I'm going to switch topics a little bit now and talk about the dementia prevention research that's been going on and what it shows. The Lancet actually it has been doing this for about 4 years or so, this dementia prevention, intervention, and care report, where they pull all the evidence that's available. And it's super interesting to see how things have changed even from 4 years ago and this year's update, in terms of what risk factors they found that are modifiable in terms of preventing dementia. And some of them are very much like personal health sort of issues, and others are actually more global policy issues that maybe need some government intervention, or global intervention. So there's 14 risk factors that they've identified this time, which is two more than in 2020. Things like lower education is a risk factor we know for dementia. Hearing loss is not necessarily as surprising as well. Hypertension, smoking, obesity, depression, physical inactivity, and diabetes. Those are all things that I think we kind of know. Excessive alcohol consumption, and interestingly enough, it's actually more than 12 drinks a day, or not a day, per week, which is more than I would have thought that's associated with dementia, as well as traumatic brain injuries, which we know, unfortunately, if you've had an insult to the brain, it makes you much more likely to be vulnerable to developing a dementia. Air pollution, interesting enough, social isolation, which is one that's come up a lot more, I think, recently and is being recognized. Untreated vision loss is one of the new ones that they've identified that has evidence for actually a risk factor for dementia that's modifiable, as well as high cholesterol. LDL cholesterol in specific is one of the new ones that actually has come up with evidence, which didn't have 4 years ago. Um, so sometimes, as I mentioned, some of these are personal medical things that need to be looked after, whereas some of these items they need advocacy for policy change because it's not something that we personally can control necessarily. So I think that um, for one thing, being it like one of the things about being cognitively, physically, and socially active, in the Middle Ages, which is 18 to 65, and really kind of pushing that. And, that's all about public health, I think. And there is a little bit of that, but I feel like over the years of my life, even like public health has been much more prominent when I was younger, and it's actually decreased quite a bit as I get older. And I think sometimes those public service announcements and more education that's visible in the communities can be helpful for promoting this general health stuff. As I mentioned, correcting hearing loss and vision loss are actually very important in terms of prevention of dementia. And we know, and there is now evidence that correcting these things actually makes it less likely for somebody to be diagnosed with dementia, whether it be giving them a better chance at, expressing themselves, but also interacting with the world. And I think it helps with that social engagement. Reducing air pollution is a very interesting one that, we personally don't necessarily have a whole lot of control over, but it's something that we need to think about. And as we think about climate change as well, it's something that's in the forefront of people's minds. And so it's something that we need to work on as a society. Reducing traumatic brain injury. Of course, accidents happen, but a lot of the traumatic brain injuries unfortunately happen with sporting, especially in the younger ages as young adults. And so advocating for head protection equipment that's appropriate and reducing any high impact collisions and heading in sports with kind of reducing those dangers will, of course, make things a little bit less likely in terms of suffering those injuries. But perhaps something that's been done a little bit better, I've noticed, is ensuring proper recovery before resuming sports, because it was much more common even a few years ago for people to push themselves to continue to play the game even though they've got an injury, or to go back to the sport, particularly high level sports, earlier than you probably should. So, interestingly, like the estimated effect, if you could modify all 14 of these risk factors, which it's a tall order, you could probably fix, delay, or prevent 50% of all dementia, which is not insignificant. I think that this is this is actually a really huge impact, but that's a very big amount of things to change in terms of risk factors. Um, so I'm again switching gears a little bit about so that's kind of a little bit more about the global thing of what you can do to reduce your brain health, but what could you do personally? And I'm going to talk a little bit about diet, physical activity, sleep, managing your health problems, as well as positive thinking, actually. Since we're at the Christmas time, we got to think a little bit more about that. So the question is, could I exercise my problems away and maybe prevent the dementia or improve my brain health? And the answer is yes, actually. I don't think this is necessarily a big surprise to everybody. Physical inactivity is a big risk factor for dementia, as well as a lot of other health issues, which are named as dementia risk factors. So aerobic exercise alone or non-aerobic exercise actually improves cognition. And that's shown in many studies. But in general, if people can be encouraged to exercise for 30 minutes, 3 to 4 times a week, it actually shows that you can slow cognitive decline over a long period of time. And the ideal is if you could do it daily. And I always say, people ask what's moderate to vigorous intensity. And moderate intensity just means you're a little bit out of breath. That's all you need to do. And sometimes that's good enough for, a brisk walk. People can do that. Although even at that, I know it's a challenge for a lot of people to do this. But if they can even make it a social event or tie in that exercise in something else that they enjoy instead of, grinning and bearing it and saying, I gotta go do my exercise for 30 minutes. It doesn't have to be like, something intensive. It can be something even like Tai Chi or swimming, something, whatever people enjoy. I encourage them to do that activity. The next question, can I eat my memory problems away? Technically, the answer is yes, actually. There's some evidence for the Mediterranean diet, which focuses on a lot more plant-based foods, as well as using healthy fats like olive oil and canola oil instead of butter. And it has been shown to decrease age-related decline. The DASH diet and Mediterranean, it's again a lot around vegetables and fruits and low-fat dairy, as well as including a good balance of other things, but also limiting salt intake. And we know that that also has evidence of decreasing age-related decline and decreasing the risk of Alzheimer's for those who follow this type of diet. I just want to draw attention to the New Canada Food Guide, which I guess isn't super, super new anymore. It's been a few years out now, but also something called the Brain Health Food Guide, which has been basically looking just at the evidence around brain health and prevention of dementias, and what to eat around that. Not surprisingly, it's very much about eating a colorful diet, including lots of fruits and vegetables, and avoiding highly processed food and limiting, things like cookies and cake and stuff like to 2 or 3 times a week, which is hard around the holidays, but as a general life thing, might be a little bit easier to do. So this is actually the Brain Health Food Guide, just so you know what it looks like. If you just Google it, that will come right up, actually. There we go. Can you keep the doctor away and still keep your brain healthy? Nope. Unfortunately not. I think that this is the thing is that if you have any issues, you need to have them treated. But the problem is if you never show up at the doctor because you think you're healthy, you're gonna get all these things are going to get missed. You need to have screening for these things, which starts usually around age 40. And then once it's identified to treat that. We mentioned already, like depression is one of the risk factors for having developing dementia, and treating that and for it can be helpful in terms of reducing that issue, reducing your issues down the line. And I think that part of that medical care is having your medications reviewed, and both prescribed medications as well as over the counter, just to make sure that you're reducing your risks or side effects from these medications, which might affect your cognition or other problems. Quitting smoking, we mentioned that's a big one as well as the alcohol in moderation and having somebody to remind you perhaps or screen that whether or not that's a risk factor. Can I sleep my problems away? I think this is a very common thing where people say, well, I can't possibly be cognitively good because I'm not sleeping well. And that's very much true, right? Because when you sleep, that is the time when your brain cleans up all of the junk out of your brain. And if you're not sleeping at all, that's a problem. But there's the research is a little bit mixed. So some studies actually show that if people sleep too much, more than 9 hours of sleep, it's actually got our increased risk of dementia. But usually I would argue that people who are sleeping perhaps more time might have some other issues, like a depression or something that's causing them to be hypersomnic or sleeping too much. Of course, as you can imagine, having a sleep disorder, is definitely associated with a high risk of dementia because you're not really getting that rest and clearing out the junk from your brain. And insomnia, particularly, is associated with Alzheimer's, and sleep disordered breathing, like sleep apnea, can be associated with all different types of dementia. Um, Oftentimes people are a little bit surprised at the recommended recommendations for sleep. So for ages like in most adults, it's usually 7 to 9 hours is recommended. But as we get older, we actually have less need for sleep. So it's 6 to 8 hours. And it's not a hard and fast rule about how much sleep you need, but it's whether or not you feel rested, and that you've had you get the benefits of sleep sometimes in a shorter period of time. Some people need a longer period of time. And one of the things too is that people are so obsessed with sleep that they will take a lot of over-the-counter medications or other things that are unfortunately associated with an increased risk of dementia because the over-the-counter medications and sleep aids actually have usually a lot of Gravol or Benadryl, which are very anticholinergic and affect the transmitters in your brain. And particularly if you use it over a long period of time, the evidence shows that it actually can blunt your cognition, make things worse for you over the long run, particularly. So we definitely want to avoid that when you're trying, if at all possible, because it kind of defeats the purpose of sleeping by making things a bit worse for you. So can I meditate my problems away? So this is a really interesting thing that's the evidence has been coming out more, I feel like in the past like 10, 20 years, where regular meditation may actually increase your cognitive function, and long-term meditation may delay decline, age-related decline, like some of even the normal brain changes. So mindfulness-based, it- MBSR. Oh my gosh, I'm just blanking out right now on that. There's that age thing coming in. No, just kidding. Mindfulness-based meditation has been a particular type of research that people have been looking into, and it has improved cognitive function in those with MCI, and found to have improvements. So I think it's one of those things to consider and to learn. But I think part of this might be with this meditation, might be about what the next slide I'm talking about is. So it's maybe, but the power of positive thinking, which I think the meditation and the positive thinking are somewhat related to each other. There are it's kind of this new research that's coming out that I find it used to be only a couple of researchers who were looking at the power of positive thinking, and more I see that it's actually expanded and into more specific types of medicine. People are researching actually this positive thinking, and so there are some things, and these are some things that they've looked at, is that even small things and small changes can foster positivity in your life and can improve your outcomes in terms of your brain health and even your physical health. So, one of them is reframing things and expressing gratitude for what you have. So, an example might be if you're sitting in traffic and you're hating your life because you're just stuck, and just stopping a minute and saying, like, oh, wow, I mean, even though I'm stuck in traffic, I'm very grateful that I actually have the means and resources to afford a car and upkeep it, as well as the gas to keep it going. And that interesting like change of thought has been shown to actually be beneficial for your brain health and your physical health. By they believe the mechanism, although it's not, of course, specifically delineated, but they think it's by reducing stress hormones in your body. The next point about accepting change as part of your life and accepting things that you can't change is also one of those little changes you can make. I say it's a little change, but it's actually quite a big thing and takes a lot of practice. And taking actions on problems that can be resolved instead of focusing on ones that you can't change is also a method of fostering that positivity. And the last point is one that I thought was really interesting, is that there's some research that shows that if you smile more, even fake smiling, like just forcing yourself to smile, reduces your blood pressure and heart rate over time. And so some of the experts are recommending that even if you just put on the YouTube for a few minutes and watch something ridiculous that makes you laugh, it'll improve your quality of life, and improve that positive thinking sort of vibe. And some of the interest, like I mentioned, the research is really interesting because there was this one that I was reading in the States where this cardiologist is very interested in this power of positive thinking. And they actually enrolled people who've had a heart attack into a positive thinking course that's for like 6 weeks. And it actually showed that those people who completed the course and did the positive thinking training were much less likely to actually have another heart attack compared to the people who didn't. So there's a lot of super interesting research coming out about this, and brain health. So I think that even though it's not kind of reach a critical mass where it's going to be, where it's like suggested by, that Lancet review where looks over all the evidence that exists, I think that it'll be really interesting in a few years from now to see if that might be included as more and more research builds up about the power of positive thinking.
Karen, there's just a couple of
Oh,
comments
yeah.
in the box there. So the it was mindfulness based stress reduction was
Yes.
the
Stress
that's there.
reduction. Yes.
Yes.
I'm just like having a brain fart there. I actually took a whole course on this. There is like one available in Edmonton. And it was super, super interesting, I felt. And it had a lot to do about this positive thinking I found that I took away from it.
Nice. And then other people are commenting about maybe yoga and Pilates, being a way of practicing that meditation and calmness too.
Oh, yeah,
Yeah.
absolutely, absolutely. Some diagnosis by positive thinking. Yeah, I see that in laughter yoga. Yes.
Mhm.
Any like it's interesting. I think not everything has been researched yet, but it's so interesting to me. Even looking into this like 5 years ago versus now, how much more research and how much more interest there is in this line of thinking that changing your thinking can significantly change your outcomes at the end of the day, which is pretty cool. And there has been some research as well in those with dementia that those with a positive outlook and positive thinking at a baseline actually do better and have a slower progression of their dementia than those who don't. And that was kind of the part one of the research. And like part two, I think that's happening now is like trying to do an intervention to change that or teach people to do positive thinking to see if it will change things, but that it's not out yet. So I want to stop there. I cut out a bunch of stuff, but I know people always have like questions about it, and I just wanted to make sure I stopped in a good amount of time for questions. But our brains are, changing with age, and most of us will not get dementia, and I think that's such an important point. But it is, of course, important to take your health seriously, and make sure that your problems are diagnosed, first of all, instead of just being like, I'm healthy, it's fine and to look after them once a problem is identified. I think it's one of those things, if you don't know the problem is there, then you can't fix it. Or you can't deal with it. If you can, exercise regularly and eat a healthy, balanced diet. I think that that's like the theme for everything. I've done kind of some research on pain, chronic pain management, and it's just same things like it's exercise does a body good and it's actually one of the best things and for pain particularly. So I think these are the staples that make things a lot better for our health if we can manage it on a regular basis. If you have any questions, that's my email. But of course, I've left lots of time right now for questions as well. I wasn't keeping track of time necessarily, but I was given 20, 25 minutes, and hopefully I didn't go too much over. I'm going to stop sharing right now.
Thanks, Karen. Yeah, great. We're just at 10:34, just so you know. Go ahead, Preet.
In Australia uh, and the UK over there, they actually been practicing all this positive thinking and the holistic way of health care. Because I took a course out that way, and they everything over there is all that, but slowly coming here into Canada. Um, and then for the power of positive thinking, that does take a lot of practice. It's a daily practice, like being self-aware of yourself. And if you are, like for myself, I'm in kidney failure, and I've had other diagnoses before in the past. But then it's that whole gratitude and the way you think of things. You just accept it as it is, especially the uncontrollable that's not in your control. And what a difference it makes. Because, like for myself, I was able to reverse my diabetes type 2 completely. I was able to get off stomach medicine, blood pressure pills, um, even when my kidney, because I had COVID-19, I went into ICU, but because of my thinking and everything, I recovered very quickly. I came out of it. I almost died, but I came back. And then even with the kidney failure and stuff, of course you do grieve and stuff, but then you change your thinking. And like for myself, I just use whatever my experiences are to help other people. But um, in that, yeah, you can heal many things. And like even for kidney function, before it actually failed this year, for 2 years, I was able to maintain it, and it got better as many times. So there is such a possibility in this power of positive thinking and in the brain. It's pretty miracle, like what the body and mind, if you work it together, what like healing that can come out of it.
I love that. Oh, thanks so
Thank
much
you.
for sharing, Preet. That is just amazing to me. And that's also why I'm so excited to see like this body of research grow more and more. Because people who know me, I'm all about like the research. I'm like, oh, have you shown that it works? Because I love to see it and I love to hear stories too. But I've like, oh, and like that's amazing. That's amazing.
There's a message in the chat here from Robin just around self-efficacy and change goal setting, Albert Bandura's work, that she still promotes it even all these years later. It's linked to thinking and our beliefs about our abilities there.
Cool.
Thanks, Robin.
I'll have to check him out.
I know I've heard that name, but you're right. I haven't read things by him for quite a while. Yeah. Any other questions, comments from the group? I was interested, Karen, to see your slide around the policy areas of things that needed to change. And when I saw the vision and the hearing loss, I was just thinking about like what is covered in our benefits, right? To have those regular checkups to be able to have that happen for people.
It's quite variable, that's for sure. And
Yeah.
it's a bit of the problem. Oh, Kathy
Yeah.
has a question.
Yeah, go ahead, Kathy.
Thank you. Typically, when I get the recordings and when I just love the information that's shared in this group, I kind of use it for personal knowledge and for my groups and my staff. But I'm just wondering if in this case, because this is so tied into exactly what I'm doing right now with two different grants, can this presentation be something that I can play or present to groups in the community?
Oh, absolutely, Kathy. I'm happy to share with it. Yeah, I share it with you. Yeah.
Thank you.
Yeah, once it's up on that YouTube channel, just use it wherever you need to use it, Kathy.
Yeah, yeah. Or just email me and I'm happy to share the slides with you as well.
Okay,
Yeah,
wonderful.
so Karen, we'll send out the slides with our follow-up email. So it'll all come to y'all in one package.
There'll be a YouTube link with it as well?
Yeah. Kate, do you want to talk to that?
Yeah, for sure. Kathy, you might have noticed in the follow-up emails, I usually do send out, or I always do send out the link to the recording as well as the slides that are presented. This time it'll be a little bit later just because our partners at Healthy Aging Alberta who upload it to YouTube, they're all on vacation as well. So I think you'll have to wait until probably after the first week in January to get the recording link, but it'll definitely be sent out.
Mm-hmm. Right. Yeah. And Kathy, if it's like, I don't know if the slides are sent out like in a different PDF format just for size and things like that. Kathy, if you want the actual PowerPoint slides, I'm happy to send them to you as well if you want to use them to disseminate or modify them for your purpose.
Oh, thank you, Karen. That'd be amazing.
Yeah, just email me and then I can do that. Yeah.
Do we have your email address?
Oh, yes, it's on the last slide. It's kchan1@ualberta.
Oh, perfect. Right. Okay,
Yeah.
yes. Okay, perfect.
And that'll be included in the email that Kate sends out too.
Yeah.
So it's also on our own slides as Karen's part of this initiative as well.
Well, thanks, Sarah, for sharing that. Nutrition information for older adults. To check it out.
Thanks.
Yeah.
Yeah, thank you.
Think like I did cut out some other of the stuff that I have been looking at before as well. I find a lot of for people asking me about, is there anything like nutritional supplements or anything that they can take that will, make it less likely for them to develop dementia or, encourage their brain health. And I've looked into many of the supplements that have, touted that it's good for your brain. And unfortunately, none of them have like any evidence that actually that improves things or makes it less likely for you to develop dementia. I think we go through spurts. Like I think 30 years ago, everybody was on like vitamin E because they're like, oh, it's gonna save your brain. And even the medical professionals were prescribing it. But now we know like that it doesn't actually make any difference, and we no longer recommend it. And I think things kind of come and go into fashion in terms of supplements, but none of them unfortunately have shown anything. And I always tell people to caution using some of those supplements and to only use ones that have a natural product number, which has some sort of oversight from the government because you don't know what you're getting. And sometimes some of these things that get sent in the mail, you buy online. I've looked into them for some of my patients that's sold as a brain health supplement. I'm like, it literally includes neurotoxins. I don't know how much because it's not like regulated, but it's listed here that this is the supplement, ingredients, and this is a known neurotoxin that actually causes dementia. So some of these things you need to really be very careful of. And I find it's like so interesting how, these things that like I'm like, how does a neurotoxin get promoted as a brain health supplement? Like it's so weird.
My goodness, have to be really careful about that. That's for sure. Yeah. Just in the chat there was some discussion around um, so yeah, Sarah shared the link and that there's a malnutrition screen. And Sarah was saying that there's a link to it on that webpage that she posted that people can have a look at it. So
It's
it's
great.
great. Yeah.
Karen, I was wondering if you know of if I know there's some emerging research kind of linking development of dementia and stuff with viral origins. I know there's a lot that's, COVID-19 as a risk factor. And I think I saw something recently that linked, Epstein-Barr virus to a higher
Mhm.
risk. So I was wondering if you knew of any of where the research is at with that, or if it's still really preliminary.
It is pretty preliminary. Like
Yeah.
a lot of those things had to do more with they're not large scale studies last
Yeah.
time I look at them, where it's like, case reports and things like that, which unfortunately means that although it might have an effect on a small number of people, it's not something that, public health can do anything about. And um, I don't think we can get rid of Epstein-Barr virus.
Yeah.
Um, and it's kind of, focusing on things that are preventable, but also that seems to be very rare from the cases that I've looked at.
One of the things that I had been thinking about, Karen, and I don't know if there is research on it or not, but the whole thing around that socialization, I think that ties in with the positive thinking. But
Mhm.
the effects that we saw over the pandemic were the lack of socialization and how quickly people declined in their cognitive functioning. Are they doing research in that area also?
Oh, they are. They are.
Yeah.
They actually did a lot of research, and I think it's starting to come out with that social isolation piece and like, the how harmful it is to cut all the ties. And I'm hoping that we never really get into that situation again, because I think things just got all locked down without thinking about, well, this person with maybe a limited lifespan anyway, by locking them down, you've really cut off all their social interactions. And, I think that there's lots of factors to it, but yeah, people have a much shorter lifespan and not just because of if they contracted COVID, unfortunately.
Mhm. Yeah, and I was just thinking, just because many of the folks here are from that community area, and just the key role of being able to keep people socially engaged, within their communities, within activities, and how that can be preventative, but also maybe slow down that progression. So it'll be interesting to see the research that comes out on that.
There is, and there already is. Like, there's enough research about
Mhm.
generally like social engagement and social connectedness as a protective factor against developing, dementia and, in general, like for your brain health. And so much like there's enough evidence to show that modifying that will make things better. Um, so it's there, and I think that it's interesting that it's not. The evidence is there, but there's not a whole lot of, willpower necessary to change that as a whole, or put in those mechanisms to automatically connect people and try to, develop those resources. I think everybody thinks of that social connectedness as the responsibility of the person themselves. And I think that's, again, one of those things that need to be done on a more systemic level to connect people into their communities. And, as we know, a lot of that work from Cormac Russell is all about that, right? Like connecting people basically makes everybody healthier and better.
Mm-hmm. Yeah. I think that's right. And it's so much of the work that we're doing with the different communities too, right? Is trying to build that base within those communities. Yeah.
Yeah.
It's nice. Yeah. To hear that the evidence for it is actually there now to kind of keep promoting that. Mhm. Any other questions from the
I'm just reading the
Yeah.
thing here. Yeah.
Yeah.
Great. Yeah, the COVID-19 and long COVID, we still don't know, right, the long-term effects of it. Because we're only a few years in, and I think it's so interesting, the long COVID. Um, and the clinics that are just starting to pop up to develop that expertise to see what can be done about it is very interesting to me, and it will take a long time, I think, for there to be a set approach in the evidence on how to manage this. Although I am hopeful as time goes on, we will have less new incidents of long COVID as people are vaccinated, and that I think becomes more um, prevalent in the population, and it becomes almost a baseline, but there always will be new, I think, because people will not have been vaccinated.
Go ahead, Preet.
Yeah, because the long COVID here in BC, 'cause I have long COVID, it's like more or less brain fog, or because I've always been over here just against my own self. Um, but it's like the brain wants to do something, but the body cannot catch up because of that long COVID. So here, the classes that they do have for it is such a baseline. It doesn't go further than like maybe there's some sort of like the mindfulness based. So that's something that I have to do on my own practice. But yeah, I would be very interested to know, I think, because I've noticed that in Alberta versus like say out here in BC, you are way ahead for many things. Um, if I were to compare it to like say the Europe area and all that, I would consider you two like the same. Whereas BC is still following along slowly. We're getting there, but yeah, it'd be interesting to read studies or something from Alberta on COVID, long COVID symptoms.
Thanks.
Yeah.
Thanks for giving us that perspective. Yeah. And Ginger's just making a comment in there about how in the continuing care industry there, so they would have been lost without the recreational therapists and recreation teams. So true, that they were so amazing and knew the potential impacts of the lockdown towns there. Yeah, we find in lots of different settings the recreational therapy field is really great at helping keeping those programming going, helping people make those connections. That's for sure.
So true.
Well, we could go back and just share our resources there. To end off the meeting. Thanks so much, Karen.
Sorry, are you guys able to see everything fine?
Yeah, it's still in the PowerPoint mode there. But there you go.
There, okay.
Yeah.
Okay, so yes, thank you so much, Karen. I think for me, interesting, not that I sleep more than 9 hours, but I'm like that could increase it or be a factor. So very interesting information you shared. So we have a couple of resources you'll see here, and links will be sent out in the email that Kate does send out. But there's the Alzheimer's Society has education, so there'll be a link there. And then there's courses for both healthcare professionals, individuals living with dementia, family, general public, staff, and volunteers. So they have their resource area. There is an article that I'll be sharing, and this came from or looks at around housing and housing insecurity, particular for mental health and addictions to support. So it's called A Solution That Nobody Even Imagined. And it talks about the village as a model. So we'll share that link. And then a webinar recording from Health Excellence Canada. This webinar was November 28th, and Helen, part of here, was part of it, and Cormac Russell was leading it. And so it's shifting from hospital beds to hospitable communities. So that'll also be shared. If you do want to see that before the email's received, you can access that through the Health Excellence website. And then just reminder of this is our website, our email, if there is anything that you're wanting to connect with us or find out more, as well as the YouTube Healthy Aging Alberta, where the final recording will be posted. And this is the Core Alberta page. Any other questions or any final thoughts? This is our contact information if you have anything else. Or everyone can head out and get back into their final last days before the holidays. Karen, any final thoughts you want to share?
Nope, just happy holidays, be safe and healthy, and see you all in the new year, I hope.
Yes, thank you. Take care,
Great.
everyone.
Thanks, everyone.